Good afternoon, Nighthawks. This is your last just brief lecture or where we're going to touch over a few of the PowerPoints. Chapter 15, which covers workplace law, employees and medical staff. It's a pretty short and quick chapter, so there's not a whole lot here. The goal of the workplace law to strike a balance between employee and employer that protects the employee from personal injury, prejudice, duress, and unwanted sexual advances while allowing the employer to pursue desired business outcomes. Okay, and this one slide really sets the tone for the remainder of this chapter. This is the goal of workplace law, for an individual to be able to come in, do their job without any type of harassment of any kind. You'll want to make sure you understand workplace laws, where they come from. Federal employment laws deals with employee-employer issues. There are federal labor laws that refer to employer-union issues or other labor practices. So you just want to make sure that you understand where these workplace laws come from. Discrimination and related laws, as you see here by the EOC or the Equal Opportunity Commission, these are just a few, and there are more, but these are just a few of some of the discrimination and related laws that the EEOC addresses. This is something that you'll want to make sure that you're aware of and understand in the workplace. The Equal Opportunity Act of 1972, this is something that every employer should be aware of. So make sure that you go through this and get a understanding of exactly what this covers. The Civil Rights Acts of 1964. And this is where we see that it prohibits discrimination based on age, race, color, national origin, sex, religion, age, disability, political beliefs, and marital or familial status. Basically, this is saying that anyone can be discriminated against for any reason in the workplace or anywhere else. And so this is a big one to understand and know. You will see this on upcoming exams, not just in this course, but in future courses as well. Diversity awareness programs or diversity, equity, and inclusion awareness and cultural competency are important to effectively care for patients. Know what your DEI policies are at your place of business. The Age Discrimination and Employment Act of 1967, American Disabilities Act of 1990, the Genetic Information Non-Discrimination Act of 2008. These are all three very, very important. The HLTH Act increased the HIPAA protections for genetic information, monitoring of employees due to potential exposures to toxic substances. This is also protected by GINA. National Origin, Citizenship, and Immigration Status, Immigration Reform and Control of 1986, and Equal Pay Act of 1963. These are all also covered under, these were covered in detail in the 1964 Civils Act. The 63 came right upon the cusp of what was passed in 64. Everything after that just kind of expanded what was passed. I'm going to skip forward to compensation and benefits. Not that those other slides aren't important, but you're going to read plenty of that in Chapter 15. Compensation includes direct and indirect pay. Fringe benefit examples would be medical, dental, life, child, elder, retirement plans, longevity pay, sick time. Make sure you understand what compensation and benefits are to be offered to the employees of the business that you work within, and understand what the difference is between compensation and benefits. Here are a couple of acts that cover that. Probably the biggest one that everyone hears is going to be the COBRA, which provides continued health insurance for a certain period of time for those who have lost coverage because of termination. COBRA can be expensive, to say the least, but they do have employees, once they have left a company for whatever reason, still have the opportunity to maintain coverage. Labor unions. We don't really discuss labor unions a whole lot in this course, and there's a brief discussion of it in your text. The total number of unionized workers in 2022 was down from the previous years, and since that time, even since now being 2025, we've seen an even larger decrease. 10% of these union members are in healthcare support occupations, and it's probably a smaller number than that now. The National Labor Relations Act of 1935. You really won't see this a lot, but this is what regulates unions and employer relations in the private sectors. Just something to briefly go over and get a basic understanding of the labor regulations. I'm going to skip through the labor regulations and unions and skip ahead to state laws on unions. And you're going to find this to vary quite a bit from state to state. State labor laws may be fashioned after federal labor laws, or state law may establish its own version of the law. Many states have enacted a right to work law, which means that a worker does not have to join a labor union to keep or land a job. Federal labor law is considered minimum law. A state may enact stricter labor laws or laws that go beyond the federal laws. I know there are several states, Oklahoma, Texas, Florida come to mind, that are right-to-work states. There's pros and cons to this, but just this is something that you'll want to know in whichever state you end up working in, if you are a right-to-work state or if you're a union state, as they would call it, because the way employees are approached and handled are very different according to the state that you're in. The Occupational Safety and Health Administration, or OSHA, this is probably, in my opinion, one of the more important organizations when it comes to employee and stakeholder safety. The Occupational Safety and Health Act of 1970 was passed to help employers reduce injuries, illnesses, and deaths on the job. Established Occupational Safety and Health Administration, or OSHA, is responsible for setting and enforcing workplace safety standards. And there is an OSHA policy at every single company in this country. And so it's very important that you know your OSHA standards and laws, and you will have to have that posted somewhere in your place of business. This is a little bit more on OSHA and some of the additional safety and legislations. Additional safety legislation, I cannot talk today, excuse me. Make sure you go through these and you have an understanding of what they are. Especially the Needle Stick Safety and Prevention Act of 2001. This was pushed by OSHA. It's very important that you and your employees are aware of exactly what that is. I'm going to skip into workplace law and the medical staff. A medical staff of a healthcare facility comprises individuals who have been granted clinical privileges to provide care to patients in the organization. This can include physicians and others such as nurse practitioners, physician assistants, dentists, optometrists, pharmacists, podiatrists, psychologists employed by the facility or function as independent contractors. As you see, health informatics and health administration staff are not considered medical staff. So I just wanted to point that out and make sure that you have that understanding. We're going to skip through the governing board. You do need to know this information, and I want to make sure that you're reading through this in your book, and that it is very important. The rest of this, just a moment, we're going to skip ahead. Determination of clinical privileges. I want to skip to this portion. It's similar to the process for medical staff application, usually applies for privileges at the same time. Expected competencies include patient care, medical clinical knowledge, practice-based learning and improvement, interpersonal communication skills, and professionalism. This goes back to, now this is all important for health informatics and health administration, but this is going to be for your medical staff, your first line providers, so to speak. Health record integrity and documentation requirements, rules for timely completion of records, legibility requirements, communication and coordination of care with others, and the completion of reports, for example, a history, physical progress notes, operative report. Failure to comply may lead to disciplinary action. It's very important for the employees, the patients, any stakeholders really in a healthcare setting, that we keep health record integrity and we maintain documentation requirements so that we adhere to the strictest of standards. Some disciplinary actions can relate in suspension. Procedures must be in place to deal with disciplinary actions and suspensions, revoke admitting privileges or time in the operating room. And once again, where the health informatics and health administration individual comes into play is you may be the one documenting these disciplinary actions and suspensions. So make sure you are up to what the policy is and what the state laws are in the state that you are working. Due process and antitrust issues required in hiring, disciplinary process, or other actions affecting medical staff and privileges. 2 elements of the due process: substantive, guaranteed laws are fair, reasonable, and not arbitrary, allows for challenges to a law's content and substance. Procedural, government shall not take a person's life, liberty, or property without the process of law. You need to know these 2. These are very, very important academically and professionally. So make sure you have an understanding of these 2 elements. And then we're going to skip to the last one. Case law, every health informatics professional should know. These are 2 laws and they're in your text, and I'll see if I can find a video that we can upload so you can watch that as well. But the Darling versus Charleston Community Memorial Hospital and the Cadillac Medical Center versus Lakeview Anesthesia Associates. I want you to take a look and read and understand exactly the importance of these. You'll find the Darling versus Charleston Community Memorial Hospital in Chapter 17 also. The Cadillac Medical Center is in Chapter 16 and goes into great discussion on these 2. But these are 2 cases that I want you to take a look at and get a better understanding on. Other than that, that's all I've got for you today. I went through that. I tried to go through that as brief as I could. Chapter 15, it's an important chapter, but it's not one that I would spend as much time on as I would some of the prior chapters, being an HIM professional. So with that being said, though, I hope you have a fantastic day, a wonderful Nighthawk Nation day. Super proud and super impressed by the collegiate learners in this program. You are amazing. Have a great day. If there's anything I can do for you, please reach out to me. If there's anything you need, don't hesitate to ask. Thank you. Bye.